So tell me more about that regulatory intelligence in pharmacovigilance. What is the difference between the general regulatory intelligence and the pharmacovigilance regulatory intelligence?
That's a very good question because what we are doing is very focused on pharmacovigilance. We are collecting regulatory news only related to pharmacovigilance, which provides a great benefit for our clients.
And what is that benefit, you think?
They shouldn't spend time on identifying those regulatory updates that are relevant for pharmacovigilance.
Because we are doing it on behalf of them.
Exactly.
Right.
In our assessment, the first step is to identify only those news that are relevant for pharmacovigilance.
What do you think about the general regulatory intelligence monitoring that regulatory affairs colleagues are doing? Is that good enough for pharmacovigilance?
From my previous experience, I can say that this is not sufficient. The regulatory intelligence should be focused on pharmacovigilance only because it is focused on what the clients, what our users need for pharmacovigilance obligation and responsibilities towards authorities.
So guide me, please, through that process. What do you do, like every week or every month, or on some other, like maybe even every day?
I'll start with Monday on the first day because we want to be on top of the regulatory or the latest regulatory updates. We are monitoring the competent authority websites every Monday. After we identify the latest regulatory updates, we publish them in our newsletter that is currently published every Monday. And after that, we assessed each news in our IV tracker. In IV tracker, we have everything connected, all news that are collected, and also the assessment, the follow-up actions, ownership is clearly assigned, and also the deadlines. Mm-hmm. This is one part of our activity. As a result of this impact assessment, we also update the country profiles in iVireg, which is our knowledge center. We are currently maintaining the pharmacovigilance requirements for more than 100 countries. And all these updates are implemented on a weekly basis in our knowledge base. Mm-hmm. Apart from that, we also assess the impact on internal processes and client SOPs.
So, in your experience, how difficult it is to create that kind of interpretation of the new piece of legislation, guidelines, Q&As, presentation from a regulator?
Yes, the interpretation is not immediately obvious sometimes, it's not quite straightforward. That's why we allocate enough time for a thorough review of the guideline. We don't rely only on the summaries. And apart from this, we also use our local experts' input from the global network. Our understanding is not only from the papers, from the regulation, but also is grounded on practice.
Yes, so do you get any kind of unpublished insights from our network of experts?
Yes, very often we receive insights from our experts because they are in direct contact with the competent authorities from those countries. They even have in-person meetings with some authorities.
What would you answer to those people who think that the artificial intelligence can actually be good enough for, searching and interpretation of regulatory intelligence?
It's very hard to respond to this question, but I can agree that AI can help us in many activities, so we can automate and make more efficient some manual activities like monitoring of the regulatory news. But in terms of interpretation, I still think that this should be grounded in practice, not only on what is stated in the regulations.
I can interpret what is publicly available, or maybe try to interpret, but it's very much prone to various misinterpretations or even hallucinations. And there needs to be still, checked by the humans. Also, quite often the interpretation is not entirely logical, is it? Like, have you seen such situations where actually legislation is saying one thing, guideline is saying quite another, and then perhaps a letter from an agency saying another interpretation?
Yes, it happens often, more often than we think. That's why we need to ensure that we assess all the documents publicly available, because we need to compare the requirements, and in case we notice some discrepancies, we need to clarify directly with the authority to ensure that we have the correct interpretation.
Everybody is doing some kind of a search, right? Then they record somehow their results, and then they are doing some kind of impact assessment and perhaps also some kind of implementation. Then the inspectors and auditors are coming and they would like to see the evidence. How easy it is to produce an evidence for inspectors or auditors about your regulatory intelligence process when you have the IV tracker and iVireg?
It's very easy. It takes a few minutes to show our process, because we have audit trail, everything is tracked, ownership is clearly assigned, and most importantly, we could also follow whether the actions are completed in practice.
So it's both actually the tracking of the news, but also tracking of the implementation
Of the, yes.
and in one system. And you also do not lose the memory, right? Because the knowledge management system is updated based on this, and you can record your unique interpretations within the system.
Exactly. We are also recording the reasoning of our assessment for each news published on a weekly basis. There are many risks if they don't use the GXP validated system, because they cannot show that the assessment is done. Sometimes they can have information in different places, in spreadsheets, SharePoints, and it's very hard to put together all the information, to understand what decisions were made, what were the conclusion of the assessment. In a GXP validated, we can handle this through a structured process, and we can have the overview of all assessments that we've done over time, all follow-up actions and all decisions.
So, Alexandra, you're extremely experienced with the impact assessment now. So, let's talk hypothetically. If you could sit on 10 impact assessments across 10 different companies, how would you recognize which one is good? What are the elements of the good impact assessment?
One of the most important part is the clarity. We need to be very specific about the scope of the impact assessment. Either we want to assess the impact on the current pharmacovigilance requirements, or on internal or client procedure and operational. This is essential. Another part that is important is the structure. We are now handling the assessment in a structured way in IV Tracker, where we can have the regulatory news, the assessment, the follow-up actions, the assigned responsibilities, and the timelines in one place. Because everything is connected, it's very easy to follow whether the actions resulting after the impact assessment are actually implemented. Second, what is also important is the time spent on the assessment of the regulatory news. It's very important to go into detail, because sometimes we can overlook some aspects, and we cannot rely only on the summary of guidelines. At the same time, it's also important to involve the local experts in the assessment, because the interpretation should be grounded in practice, not only on the regulations. And also, it's very important to ensure that the outcome of the assessment are actually implemented, If not, we can risk to have assessment at the theoretical level.
And why do you think it's better to have that impact assessment recorded in one GXP system? Why is it better than, people who don't have GXP system?
Because it helps us to have a clear visibility and structure. We can see exactly what decisions were made, what are the outstanding actions after the assessment, and also we can ensure that the outcome is implemented in practice. I think that this is the most important and challenging part.
And do you think that the interpretation can change over time of the same legislation, maybe?
Yes, definitely. We can have different interpretation of the same regulation, especially when new guidelines are published. We can realize that our initial interpretation was different.
Right.
That's why it's very important to ask for insights from multiple local experts.
And also perhaps that's why it's so important to have that clear record about, this period of time we believed in this interpretation, this period of time we believed in another interpretation. So when there is an inspection or investigation of a case or some issue finding, critical finding in the history, you can demonstrate the evidence, what was the interpretation of that time, which led to those kind of decisions. Right?
Indeed, it is essential to have the source for our interpretation so we can prove why the reasoning for our decisions at that time. So what we do, start with basic. We review the guidelines to see what has changed and what is relevant. Without that, we cannot do a proper impact assessment.
Mm-hmm.
What makes efficient in our process is that we have the current pharmacovigilance requirements across more than 100 countries in our iVireg. Mm-hmm. And this gives us a baseline. We are not starting from scratch when we have regulatory news. We already are aware of the current requirements, so we know exactly what has changed. After that, we will continue our impact assessment in IV Tracker, where each follow-up action is tracked, the ownership is clearly assigned, and also the timelines. Based on that, all the updates are implemented in iVireg within a defined timeline based on the impact level and urgency, and everything remains connected.
So for someone listening to this right now and thinking, oh, this is us, we are actually stuck reacting and never getting ahead of it, what is the one thing they should stop doing and the one thing they should start doing?
Thank you for this question. I would say that they need to stop managing regulatory intelligence in a fragmented way across emails and email threads and spreadsheets, because it's very hard to have clear visibility of the ownership, of the pending actions, and also of the previous decisions. I would say that they need to start using a structured process. Mm-hmm. And for us, what helps us is iVireg, where everything is connected. The collection of the regulatory news, the assessment, the follow-up actions, the ownership, and also the timelines. We can also have the possibility to check whether the follow-up actions were implemented in practice, which is the main reason for this impact assessment. Mm-hmm.